Two complications that can occur on a baby's head, especially if they have a vacuum-assisted delivery, for example, are caput secundum and cephalohematoma. Cephalohematoma is when they have a bump on their head and there's an accumulation of blood in that pocket. It does not cross the suture line, and it can take a couple weeks to resolve. During this time, the red blood cells in that pocket are going to down, and that's going to cause hyperbilirubinemia. For caput secundum, this edema that they have will cross the suture line, and this will only take a couple days to resolve. And the S in secundum is how I remember that it crosses the suture lines. And then speaking of hyperbilirubinemia, this is common in newborns that are premature or exclusively breastfeeding. And to treat this, you can do phototherapy if the levels are not very high, but once the levels reach to about 20 to 25, that's more dangerous. So you want to do an exchange transfusion. And it's dangerous because at those levels you can get kernicterus. A subgleal bleed is when you have bleeding between the scalp and the periosteum. This will rapidly expand and can cause hypovolemic shock. So you need to monitor the baby in the ICU. Another complication at birth is neonatal clavicular fracture. This is very common when mom has gestational diabetes, for example, and they're delivering a big baby. They will have localized crepitus around the clavicle, and they'll also be very irritable, especially with passive movement of their arm because their clavicle is fractured. They'll also have an asymmetric moral reflex. For this, you don't have to do any treatment. It's just supportive. You don't need to cast them or anything, and you can diagnose this by doing an x-ray. Fetal growth restriction is defined as less than 10th percentile in weight, and this can be symmetric or asymmetric growth restriction. If it's symmetric growth restriction, that means like globally they're small, like head to toe, and it's usually caused by chromosomal issue or an infection occurring in the first trimester. If it's an asymmetric growth restriction, meaning it's head sparing, so their head will be really big, but then the rest of their body will be really small. This can occur in the second or third trimester, and it's usually due to uterine placental insufficiency or maternal malnutrition. After the baby's born, sometimes they have increased labial swelling or leukorrhea. Sometimes they even have uterine withdrawal bleeding, and that can be concerning, but it's just occurring because of the maternal estrogen that's still present in them, which takes a little bit of time for it to go away, and then everything will be normal. Amniotic fluid embolism is another complication a mom can have after birth, and that'll present with cardiogenic shock, hypoxic respiratory failure, kind of like a PE, but this will happen right after birth, so it's from an amniotic fluid embolism.